For decades, the global perception of India's demographics has been locked onto a single image, a relentlessly expanding youth bubble stretching the country's basic resources. But the latest National Family Health Survey, a massive data collection effort spanning over 600,000 households, reveals a modern reality contradicting those old assumptions. This chart maps out the first major anomaly. The percentage of the population below age 5 is dropping across the country. And the secondary indicator follows the exact same trend. The population below age 15 is also shrinking, proving the demographic foundation is narrowing. India has quietly navigated away from explosive expansion, completing one of the largest and fastest demographic transitions ever recorded. Look at how this population pyramid is shifting. While the youth base shrinks, the corresponding data points show the population over age 60 is now noticeably rising. Western nations took over a century to reach this stage of demographic maturity. India is completing the process in a matter of decades. This forces a central question. How exactly did a developing nation of 1.4 billion people secure basic survival and stabilize its growth so rapidly? The data shows this was no organic accident. It is the direct result of two simultaneous systemic revolutions playing out at the ground level. The foundation of this transition was built on physical infrastructure. The baseline fight against basic resource scarcity has largely been won, with access to electricity and improved drinking water now reaching nearly 99% coverage nationwide. With those fundamentals in place, the system pivoted to a massive expansion of medical infrastructure, specifically aimed at maternal and infant care. The results are striking. Institutional hospital deliveries have soared past 90% almost universally. In several regions, the integration is nearly total. States like Kerala and Tamil Nadu are consistently hitting 95 to 98% institutional birth rates. Because babies are born in clinical settings, they are immediately captured by the health system, translating directly into routine, universal childhood care and vaccinations. But building physical hospitals and defeating scarcity only provided the tools. The actual catalyst for stabilization required changing who made the decisions to use them. The transition has been largely accelerated by the rise of female autonomy. This line graph tracks female financial inclusion. The number of women holding active bank accounts has surged to roughly 90%. Over that same period, digital inclusion followed an identical path, with female internet usage doubling to over 64%. The causal link here is direct. When women control their own finances and have direct access to information online, they exercise far more independence over family planning and medical decisions. The data reveals a consistent pattern. When digital and financial tools are accessible, demographic stabilization follows as a measurable result. Overcoming the survival barrier has, however, introduced an entirely new complication, the prosperity penalty. As the threat of basic infectious disease fades, the frequency of complex medical interventions is skyrocketing, and the data shows they are often applied unnecessarily. The clearest indicator of this hyper-medicalization is the startling surge in cesarean sections, driven primarily by private medical facilities. Looking at this map of India, you can pinpoint the severity of the trend. In states like Andhra Pradesh and Telangana, C-section rates in private hospitals are hitting 50, 60, and even 90% of all births. The healthcare system is no longer struggling to deliver care. It is grappling with the intense commercialization and overapplication of it. Projecting these current trajectories forward to the year 2035 clearly defines the impending challenge for the next generation. The national priority must shift away from building basic rural clinics to managing complex, chronic lifestyle diseases for a vast and rapidly expanding elderly demographic. From fighting scarcity to managing prosperity, India's greatest health challenge may still lie ahead.